Okay, so we're going to take a look at some oxygen delivery devices. I have a couple different ones here with me. This machine is called a concentrator. This takes room air and concentrates it to whatever oxygen level you need. And if I get closer here, this is the area here that you choose how many liters per minute. So if somebody is on 2, you turn the dial to the little ball, floats up to 2 liters per minute. There's an area here that you hook the nasal cannula onto, and then there's the power on and off button. This machine actually has the capability to fill oxygen tanks, which is what this is up here. So we have oxygen tanks that fit right up on this, and it fills it, and we don't have to have them sent out, which is really nice. Then we also have portable oxygen tanks. These come in a variety of different sizes. I actually have 2 different sizes. Give me 1 second. So this is a larger one, and then I also have small tanks, so you can see the size difference. And the important thing with an oxygen tank is you never want to leave it sitting upright if it is not in a container that will hold it. So for example, oftentimes there's little carts that have wheels. It's perfectly fine to sit that up in that, but if you don't have a cart, if you don't have the special racking systems to store this in, you need to lay it down. It can become a weapon, essentially. If it is standing upright and falls over, it is filled with compressed air. It will shoot off like a rocket. So make sure you lay it down so that it does not have any issues. In order to use one of these tanks, you need to have what is called a regulator, and that is what this is. So an oxygen regulator allows you to regulate the amount of oxygen that is coming out. If you did not hook this on, you wouldn't have anything to hook the nasal cannula into, and oxygen would just be free flowing out of the tank. When you're hooking this on, you have to take a look at the top of the oxygen tank. One side has multiple holes, so there's one in the top and then 2 beside it. The other side has 2 areas. They kind of look like holes, but they're actually not. They're just the places that the pins attach into. And then you look at the regulator, and inside you have one side that has a rubber gasket with 2 projections, and then the other side is where you tighten it. What is important is when you're putting this on that you line these up correctly on the tank, but also that you make sure that that little black rubber gasket is there. If the rubber part is missing, which sometimes happens, it gets knocked off, every time you try to crack open the tank, air will push out of the tank quickly. So just make sure you're paying close attention to that. Let's make this a little bigger. Sorry, should have did that from the beginning. There you can see the rubber gasket, the 2 projections, and that lines up with this side. Okay, so when I'm setting this up, I'm just going to slip my regulator on, making sure I get the right sides correctly lined up. I'm going to push the rubber gasket side in against the tank, and then tighten the opposite side, making sure that it is lined up correctly, and just tighten it till it's tight. Now, you'll notice that my tank, let's see here, the pin is reading in the red area, which is refill. And that is simply because I don't have this opened up. Once I open it, once I turn it and I crack it, you'll now notice that the pin went up, showing that there is oxygen in the tank. If this is not seated correctly, when you turn this, and you don't have to keep turning it, you just have to turn it to where you hear the little pop. If it's not seated correctly, air will be flowing out, and it's very loud, and I'll possibly in a second, like that. But it'll keep doing it. And if you turn it on and you don't hear that, then the air's fine. Or the regulator is on fine. Again, you don't have to keep turning it. Once this is on, if it's still in the red, that means that the tank is empty and it does need refilled. So just make sure that you have adequate oxygen for whatever you're doing. So even if it's getting close to refill, but you just need, let's say, 5 minutes worth of oxygen just to get from point A to point B, you're probably going to be fine. But if you're going to be doing let's say a full hour therapy session and you're going to be using this tank because they're going to be outside of their room and they can't be on the wall unit, you need to get a new tank that's refilled. All right, so once you get the regulator on, then you will hook your nasal cannula tubing on, and you'll turn the dial, which you'll see then increases the amount of oxygen coming out. So if they're on 2 liters, you turn it to 2 liters. Make sure that the person has their nasal cannula on. A couple of different things about, let's turn that off, about nasal cannula, and this is a pediatric one, so it's kind of small compared to normal, but so you have the 2 prongs. When you look at the prongs from the side, they generally have a directionality to them, so they curve down, and if I turn it the opposite way, then it looks like they curve up. When you think about putting this on, you need to think about how air flows through the nose. So if my prongs are pointed up, so if they look like this, and this happens a lot, and I put that in my nose, that air is going to shoot up at the top of my nose. So if a patient is complaining about their nose being dry, it might be because this isn't upside down. If you turn it so that the prongs are kind of tilted downward, when you put it in your nose, the air then goes down into your nose towards your lungs, which is, looking at the anatomy, that's the way it should be. So, pointed down in your nose, behind your ears, and tighten. One of the things that I see frequently is that people will do one of these numbers, like all around their head, putting it on. Nope. In the nose, behind the ears, and tighten. Hopefully you got to practice not only putting it on yourself, but on another person, because let's be honest, we're putting them on our patients or helping them. We're not putting it on ourselves. So if I'm working with an individual that's on oxygen, they should have this on. I'm going to check to make sure they have it on correctly. When I'm getting them up and moving, if they are, let's say, in a hospital room, in a nursing home room, that they have a wall unit, I'm going to make sure I have my oxygen tank ready. I'm going to make sure I have my regulator on, the oxygen flowing, before I disconnect the nasal cannula from the wall and connect it onto here. I never want to take them off the wall, put them on here, and then fumble with turning the oxygen on. Have it on, and then do it, just so that there's no, there's not a stoppage in the amount of oxygen that they're getting. And same thing goes if they're on, if they're connected to here because they're at home, and you're going to go for a walk outside, and they're wearing this. I turn the oxygen on in my portable tank, and then I move this over. Some different things about oxygen. So I think there was you should have received a handout about different types of supplemental oxygen. So we have what is called low flow. Low flow uses either clear or sometimes they're green tubes, but they're really pretty flexible tubes. They're not very thick, because low flow is typically going to be anywhere from 1 to 4 liters of oxygen. It can be higher than that, and that's just the amount of oxygen that is coming out in a minute, so 1 liter per minute of oxygen. When we start talking about high flow, the tubing is a lot sturdier because there's a lot more pressure coming through it. The nose piece is thicker as well, And again, high flow is going to have more pressure behind it, and we're usually talking about higher amounts of oxygen. It can go up to 15 liters per minute. And with high flow, not only can they regulate the amount per minute, but they can also regulate the amount, the saturation of oxygen that they're giving within high flow. So it's a little bit more, there's a little bit more parameters that can be worked with. And but if somebody's going home or is in a nursing home, they're typically, they're only going to be on what we consider low flow. Be careful, depending on the type of facility that you're in, they may or may not allow you to change oxygen. There has been some comments in the past that some of the nursing homes in the area don't even allow you to take somebody off like a wall unit and put them on portable. They have to have nursing, which I don't understand because it's nowhere within our the scope of practice of a PTA or outside the scope of practice of a PTA or PT in the state of Pennsylvania to do that. It is outside of the scope of practice of a PTA to change an oxygen amount. So titrating the oxygen, again, going something from like 1 to 2 liters or 2 to 1 to change the amount of oxygen. However, if your supervising physical therapist says, you know, we're going to try this, then it's okay as long as you've got like an order to do so. So, for example, we might be working on weaning oxygen with mobility with an individual, and so your physical therapist, supervising physical therapist, should have gotten an okay from the doc, and then they pass that on to you. But you never want to change that. So if someone has an order, because oxygen is considered a medication, so whatever their order is what you need to do. I don't think I have anything extra on that. If you have any questions, let me know. Thank you.